Hi, everybody. Ahead over the next half hour, where we stand in the fight against COVID-19 in Western New York. We're going to be talking about the trajectory that we're seeing right now and what could be coming next. Plus, a question for the Verify team about President Biden's vaccine mandate and does it apply to members of Congress? And if you want to save some money, I should say, apparently now is when you'll want to make travel plans, and you won't want to wait too long either. We'll get some tips from a travel economist coming up in just a moment. Glad you're here with us, everybody. Thanks for joining us. I'm Michael Wooten. Kate is off, and we are starting a new week and about to start a new season with fall right around the corner. Yet it is a similar story playing out in terms of the pandemic. Still seeing that uptick. And we wanted to try to get some perspective for you tonight as you try to make sense of how things are going right now. The numbers really do tell the story here. This is the 7-day total of new cases per 100,000 people, and specifically Erie County. You can see we are now at 152 and climbing. It's higher than we've been at any point since May. And remember, we were on the downswing at that last point in that surge. And look how low we got, down to just 3. The same is true for hospitalizations, which are now at 183 in the Western New York region, 12 new patients just compared to yesterday. And we've stressed this here before. We are not seeing the situation as bad as some other parts of the country, but we are also a lot worse off than we were a year ago and headed in the wrong direction. So joining us right now to talk about all of this is Dr. Thomas Russo, Chief of Infectious Diseases at UB's Jacobs School of Medicine. Dr. Russo, always great to have you on the show. Erie County had 314 new confirmed cases on Friday, the highest single-day total in about 5 months as we were looking back through the records. What do we know about all of these new cases? We know that the Delta variant is behind a lot of this and it spreads so much easier. We also know that kids are going back to school right now. How are you kind of processing all of these numbers?
Well, that number was a larger number than we were hoping for, but there was no particularly large outbreak associated with that. There was no school outbreaks that were associated with that. And so the cases were similar to other cases that were being seen during this Delta wave. Now, there's a couple of possibilities why that number was a little bigger than some of the other daily numbers that we've seen. On that particular day, testing was up anywhere from 10 to 50% more than other days in that week. And additionally, the timing of that is some of the festivities over the Labor Day long weekend might have contributed to a little bit bump in cases as well.
The rate of spread in our community right now is, as we mentioned, a lot higher than it was at this time last year. I mean, when we were going through the summer, it looked really good here last year, even though we didn't even have access to vaccines yet. Hospitalizations are now increasing as well. And we don't have the same pandemic restrictions that we had, which maybe kind of helped us this time a year ago. So when you look at the numbers, what do you think we need to do right now in terms of trying to keep people from ending up in the hospital?
Michael, you were freezing up a little bit. Hopefully you finished your question. And so can you hear me, Michael?
Yeah, yep, good to go.
All right. Well, I'm going to go ahead and answer your question, Michael, even though I didn't quite hear all of that. So yes, a combination of the Delta variant and our activities have been driving cases up compared to last year. Obviously, we've been partying pretty hard, and this has contributed to a number of infections. And though our vaccines are not perfect, the majority of cases, hospitalizations, and deaths are occurring in the unvaccinated. You know, our vaccination rate has blunted this wave compared to earlier waves, but you know, we still have 41% of people here in Erie County that are not fully vaccinated. They're susceptible to getting infected. So what can we do to try to blunt this wave and have some damage control over the next few weeks? On the short term, I think we need to gather ourselves and try to minimize putting ourselves in risky situations. Further, you know, there may be consideration of reinstituting a mask mandate in high-risk public indoor settings. And lastly, where masks cannot be used, maybe there should be consideration of a vaccine mandate, such as in restaurants and bars. On the long term, you know, it's quite clear. more vaccines. It takes 5 to 6 weeks to get the regimen done, so it's not going to help us immediately, but obviously it's going to help us moving forward.
I can see my signal on our connection now, and I'm back to 5 full bars, so I believe you can hear me. So we'll continue on. You did a great job with that.
Michael.
Yeah. So of course we all know there were nearly 70,000 fans at the Bills game yesterday. The county does have the mask requirement for the indoor parts of the stadium, which includes the concourses, even though a lot of people don't even realize that is considered to be an indoor space. I wonder what you thought as you were looking at the videos. Obviously, a lot of people were not wearing masks. It's sort of a tricky situation, right? Hard to enforce, and people feel like they're outdoors. What did you make as you looked at what happened with the NFL game yesterday?
Well, we know that obviously in outdoor settings, risk of infection is less. However, when you have large groups of people in close quarters for a prolonged period of time, and I think the Bills game qualifies as such, obviously there's going to be a risk of infection. And as we know, there is no vaccine or mask mandates in the outdoor venues there. I saw very few masks. I talked to a few people at the game, and there was really no mask police. So we know there's likely some infectious individuals there, and I'm sure some infections occurred. Moving forward, assuming that we remain without a vaccine or mask mandate for these games, I think that we should have certain individuals that need to be particularly cautious. And that remains the unvaccinated, our immunocompromised, and our seniors with underlying disease. If they go to the game and if they choose to do so, they should wear masks, despite perhaps the peer pressure to do otherwise to protect themselves and others.
Finally, Dr. Russo, I wonder if you've given any thought as to when you think this is all going to end. I feel like we've asked that question since it began more than, a year and a half ago. The vaccines were kind of seen as the light at the end of the tunnel, but here we are, and we still have a lot of people who have not been vaccinated. What do you tell people when they inevitably ask you that question? When does this end?
Yeah, I think about that every day, Michael. And so, let's start with the Delta wave. What we've seen in other countries and parts of this country where the Delta wave hit first is it tends to have an upward trajectory of about 8 weeks, followed by a downward curve of 6 to 8 weeks. Well, right now, we're really right about that 8-week plus mark. And there's a hint in our data that hospitalizations are plateauing and maybe even cases are plateauing as well. So I'm hoping we're going to hit that downward trajectory. I think we're going to do okay once we get to the bottom of that for a short period of time, but then we're going to be onto Halloween, Thanksgiving, the religious holiday, and New Year's. And I think we're going to have another bump of cases, and the magnitude of that will be commensurate with how well we do with vaccination between now and then. I think 2022 is going to look a lot better. I think at that point, since this Delta variant is so infectious, that the virus is going to start to run out of people to infect. And I think it's going to settle in to be a more seasonal virus moving forward.
Great to get your insight as always. Dr. Thomas Russo is Chief of Infectious Diseases at UB's Medical School. Have a great evening.
Thanks, Michael.
All right, when it comes to the vaccines, our Verify team has really been asked a lot lately about President Biden's order last week mandating the shots for millions of workers. People have claimed on social media that Congress is not included in that, and they're asking why. So we asked our Brandon Lewis to explain.
President Joe Biden announced a vaccine mandate that would affect more than 100 million Americans at the nation's largest employers. But one Verify viewer wants to know if that includes Congress. So let's verify. Does President Biden's vaccine mandate include members of Congress and their staff? Our sources are the White House, the Congressional Institute, and the Library of Congress. When President Biden announced his mandate, he singled out federal employees and one branch of government, and it wasn't the legislative.
I will sign an executive order that will now require all executive branch federal employees to be vaccinated, all.
While President Biden controls the executive branch, which includes employees of the president, vice president, and his cabinet, the Constitutional Institute says President Biden has no power to regulate Congress. So it's false that President Biden's vaccine mandate includes members of Congress and their staff. Last month, 20 representatives asked the attending physician of Congress, Dr. Brian Monahan, to consider mandating vaccines for Congress and their staff or require twice-weekly testing. In July, Monahan mandated Congress wear masks inside shared spaces, but he hasn't required vaccines in response to their letter. With your Verify, I'm Brandon Lewis.
Brandon, thank you. Coming up for us on this Monday evening, as we look toward a win in week 2, we'll answer some of your questions about what went wrong for the Bills during the season opening loss yesterday. And as we go to break here on the Town Hall, a message that really caught our attention while we were in New York City this weekend, 20 years after 9/11. The sister of a victim from here in Western New York who died in the Twin Towers, talking about the difference between then and now.
Remember, everyone went out and bought flags, and then you couldn't get flags, and they were hanging the flags. People were kinder, and it was just a different time. And so maybe with the coverage that's happened in the United States, this week leading up to 9/11, maybe we'll get back to that time, I hope.